Social poverty, yeah? Okay, go on. Health and social. Starts with the L. Quickly. Stop doing that.
We have two poverties.
Be audible.
We have two poverties. Two types of poverty. Social, political poverty, and health poverty. Simon is going to talk more about social poverty.
Health poverty is when we do not have a proper medication. For example, in Turkana, we have a lot of people dying because of sickness, and they don't have the right access to go to the hospital. And doctors, if they go to doctors, they will not be able to be treated well. Yes.
Mm-hmm. That's all about healthcare. Anything else to add on healthcare? Yes.
Another example.
You're talking to yourself.
Another example is when you live in a place where it's far from hospitals, so getting the transport becomes too expensive. And also, for example, when you live somewhere like in Moranga, where it has houses all over, so you have to pass through long miles and meters for you to reach a hospital. And whenever you reach there, you also get so many people there because it's a public hospital. So many people are there, and sometimes there are corruption that happens where one person who comes in pays money to get treated earlier. Then you who came earlier, you have to stay there for the rest of the day, which at the end of the day you don't get great treatment, and at the end you might not heal and you might die, which will reduce the population of Kenya and the people and then
Good. Do we agree? Whose function is it to do healthcare? Whose function is it to provide healthcare? It's the government, right? So the private hospitals come up because the government fails to give proper healthcare. Now, one thing I need you to go and research and see is that healthcare is not all about having a hospital with no medication. Because do you go to the hospital to just be treated by the walls? Or if the doctor tells you you need medicine, you need to get access to medicine. Okay? For example, we have a hospital here. Are you sure if you go outside in that hospital and get treated, you will get medicine? I did a social experiment and I went there. The doctors are great. The system works. There is even a card you're given. But now when it reaches the medicine, there is no medicine. They have to write for you the medicine, you go get the medicine outside. So imagine how much it will cost you to go get medicine outside. It's better to have a small hospital, but it has medicine. So the reality is the government has to invest heavily in healthcare. If you're not healthy, are you able to become productive? As a result, you become poor. Okay? So if the government is interested in the economic development, they have to invest in healthcare. Are we together? Okay, and now I need you to go and research further and see the counties that are doing well in healthcare. Because in Kenya currently the healthcare is a devolved function. Okay? Okay, next.
Social and political.
You're here to talk.
Social and political.
Uh-huh.
This happens when you are isolated and you don't have any access to work.
Uh-huh. Example. Give him support. Hey.
Example, somewhere in Turkana,
Uh-huh.
resources are not enough compared to Nairobi. So mostly the government focuses more on Nairobi than Turkana, which makes the Turkana people be isolated from this society. They do not have enough resources, and there are also no jobs. So at the end of the day, they will not become productive, and they will end up in poverty. Yes.
Good. Do we agree that some time where you stay can determine whether you get a job or you do not get a job?
Yeah.
Do we agree? Yeah. Now imagine how competitive is someone who is in Nairobi getting a job as compared to someone who is in Turkana. Who will get a job first? Nairobi. Because you are exposed, right? So the person in Turkana is limited by the social environment in which they live in. Let's look at political. When we choose our leaders, do we understand that the political leaders we choose affect our poverty levels? No? We feel, are the leaders the one who affect our poverty levels? Yes, right?
Yeah.
Because remember, who represents you in terms of how money will be allocated?
Leader.
Huh?
Government.
Who makes the government? The president is the first person you elect. Other than the president, who else make up the whole leadership team? The MPs and the senators who you appoint and the governors, right? So if they do not make the proper legislation, if they do not allocate funds into the right channels of development, you will remain in poverty. Ask yourself, why would you go to some other places they look more developed? You go to other places, they look like there's no government there. It is because even if you give equal resources, if the political leaders who are supposed to implement the projects don't do the right projects, you will not be able to feel the impact. And so the poverty level will continue. Do we now understand how the government versus us, we affect each other in terms of poverty levels?
Yes.
Yes. So the next coverage we're going to cover is we're going to cover what triggers an economic development and human development. Now that is when we look at GDP. Who remembers what GDP stands for? Gross domestic product. So we look at factors like those. We'll look at what affects the population, what affects the productivity of our population. Are we together?
Yeah.
A big clap for this group.